Hi everybody, this is Arkady Frekhtman, personal injury trial attorney here in New York, and today we're talking about further treatment for knee injuries. Now, a common knee injury is going to be a torn meniscus, and what that basically means is you see here, you have these little pillows, and they are between your tibia and your fibula, and then the top bone, and you have, that's the knee, the whole thing is the knee, and then you have these little pillows called menisci, and they can get torn, either the lateral or the medial meniscus. And when they get torn, after, let's say, a car crash, a slip and fall, any type of injury, what you need to do, if the doctor thinks it will help, is known as an arthroscopic surgery. So it's a quick procedure. They go in with a camera and they actually repair the tear, depending on the type of tear that it is. They fix it, and usually it's pretty quick. It could be done as quickly as, 15 or 20 minutes, but usually not longer than like an hour. And then afterwards, you need a little bit of recovery, but you feel a lot better. Because now you don't have the tear. Because if you have that tear and you don't fix it, what happens is you have bone on bone, which is very, very painful, and it's just gonna get worse. And if that meniscus gets completely eroded, the only other option is to do a total knee replacement, which is a major type of surgery. So we often see torn meniscuses. Usually we see them on MRIs, which are magnetic resonance imaging, right? So that's what tells you what your injury is basically. That gives you a medical diagnosis. So if you are in, let's say, a car crash, and then you have an MRI and it comes back as a torn meniscus, then your doctor may speak to you about this, which is further treatment for the knee. The other options are just doing injections into the knee, which kind of serve as pain relief. So the doctor can decide together with you what's the best option, but that's very common, known as a scope or an arthroscopic surgery. So I just wanted to explain it. And if you do have this and are considering it, the best thing to do is speak to your doctor and also speak to your case manager here at the law firm. And I want to make myself available too for a consult, and we could talk about the best options going forward.